is CT Live.
Good morning, everybody, and welcome to CT Live. I'm Taylor Kinsler, and we are coming to you live on this Tuesday from the NBC Connecticut studio. Coming up today on CT Live, if you have a nagging injury, we'll show you how to make adjustments to your workout to move and exercise safely. Are you currently dealing with an injury, or have you had an injury or surgery in the past that maybe makes you feel like it's holding you back from getting a good workout? The good news is there are always ways to move and exercise safely. So Dr. Roberta Garceau of My Yoga Joy shares some simple ways to make adjustments to your workout and stretches.
Thank you so much for having me back. It is great to be here. There are always ways that you can move and exercise safely. You'll want to consult with your healthcare provider who knows the do's and don'ts of your particular situation the best. But once you know the rules, you're free to change your thinking from what you can't do to what you can do. Now, the following does not constitute nor substitute for medical advice, but you want to think, modify, support, and create solutions. So come on and let's get started. All right, so let's say that you have an injury to your foot, ankle, or leg that prevents you from weighting one side of your body. You can modify by placing a foot or your knee on a chair or a bench or other support. And then you can, studies show that when you exercise one side of the body, it can actually help to maintain the strength on the opposite side due to cross innervation in the brain, which is really pretty cool, I think. Another thing you can do is get creative. You can use a chair as support for a lunge or other stretching and strengthening exercise. The take-home message is some movement is better than no movement. So what if your injury is to the upper body, a shoulder injury or something in the chest region? I've worked with folks who are recovering from shoulders and from mastectomy, where there's scar tissue in the chest region. You can't really put direct weight on the chest or shoulders. Basically there, you're going to think modify. So if getting two arms up overhead is not within your range of motion, you're going to bring one hand to the hip and go from here. If that's not available, bend at the elbow, put the hand behind the head, make a little chicken wing, and work from there. Still not happening? Just place both hands on the hips. You can still move in some way, right? Now, how are you going to maintain strength in your upper body? Get creative. If you can't do a push-up or a plank or some other arm exercise, you can still improve your range of motion by moving in different ways, working on your strength and energy. Beautiful. All right, what about knees, wrists, hands? The inspiration for today's episode is I got a fracture in my hand that's been healing the past couple months. You can work with anything. So coming down to your hands and knees, tender knees can be cushioned with a blanket. And then if you can't come down onto flat hands, you can cushion tender wrists by coming onto fists, or modify by coming down onto elbows, or supported elbows on blocks. And now here you are in a table position, coming right on up to plank. Gorgeous. Now, if your knees can't get in this position, no worries. Take a pillow or a rolled up blanket and just tuck it under your shins. And that can release a lot of pressure from the knees so that you can safely exercise. Take home message, some movement is better than no movement. Work within your range of motion and just keep moving, right? So seek professional guidance, work within your range of motion, and keep on moving by modify, support, and being creative.
Really great tips to remember. And I know a lot of you are thinking, gosh, I can't work out at home. I don't have everything that I need to do. So you can even use items like a can of pasta sauce to be able to, do your curls or whatever you want to do. You can utilize the items that are in your home to get a good workout, make sure you're doing it safely. And I got to tip my hat to people like Roberta Garceau, Maggie Downey, and our friend Lorianne at Body Construct. They are adapting to make sure that you can still get that workout at home. So we appreciate all of the trainers, fitness educators out there who are doing what they can to help people stay fit, even though they can't be in the gym right now.